Hi students, now we are going to discuss some of the NEET based MCQs in the last 4 years question paper, which are the frequent questions that have been repeated in oral histology, and how do you choose the right answer for each of this question is what we are going to discuss today. Some of these questions are very straightforward and you can easily pick up the answer, but there are some questions, especially in histology, you don't get much of confusion. Most of it are straightforward questions, but there are some questions which are like twisted and different terminologies are used. So in only those questions you have to be careful to pick up the right answer. So we will see one by one how to choose the right answer for each of these questions. So which of the following is a type of tertiary dentin? So we know that dentin is primary, secondary and tertiary types, and tertiary is a type of pathological type of dentin. So the question is which of the following is a tertiary dentin, and options given are mantle dentin, sclerotic dentin, reactionary dentin and transparent dentin. Mantle dentin is a type of primary dentin. We all know that. Primary dentin is mantle and circumpulpal dentin. So that option is out. Sclerotic dentin is totally different type of dentin, which is actually dense minerals are getting deposited within the dentin and tubules. That is also not the option. The other name for sclerotic dentin is transparent dentin. So the option left is reactionary dentin. So you already mentioned that there are two types of tertiary dentin, reactionary dentin and reparative dentin. So if the dentin is formed from a pre-existing odontoblast, then you call that as a reactionary dentin, whereas if the undifferentiated mesenchymal cells of the pulp differentiate to odontoblast and they form dentin, then that is called as a reparative dentin. Next question is the predominant cell type in pulp. It's a straightforward question. Pulp is a specialized form of connective tissue like periodontal ligament. So any type of connective tissue, the main cell that you will be seeing is your fibroblast. So please remember, undifferentiated mesenchymal cell, mast cell, Langerhans cell, all of this will be seen in the pulp. But the question here is predominant, which are most numerous type is which type of cell. So the answer is fibroblast. The same question can be asked in periodontal ligament also. The predominant cell type in periodontal ligament, again the right answer is fibroblast only. The function is to form the fibers and ground substance. The third question, which of the following is not true? So please note this, it is not true regarding the undifferentiated mesenchymal cells of the pulp. So you have undifferentiated mesenchymal cells. What is not true about that? What is false is what they are asking. Found along the blood vessels, they are totipotent cells, they are polyhedral in shape, increase in number in old age. Now all the first three are true about mesenchymal cells. That is, they are totipotent cells, which means what? They act as a stem cell. Whenever there is a need, they may give rise to either odontoblast or fibroblast, depending upon the need. That is why they are called totipotent, because they have multiple potency and they are stem cells. And the shape is approximately polyhedral or polygonal in shape. And usually within the pulp, the important feature of the undifferentiated mesenchymal cell is they are seen along the blood vessels. So all these are true. Which is not true or false? It is increase in number in old age. Why? One important feature I have mentioned in the age changes of pulp is that any cell will decrease in number as old age approaches. All the cells, any cells in the human body will decrease in number. So even in pulp also, as the person becomes older and older, the number of cells will decrease. But here it is given increase. So that is the right option. The fourth question is, the pulp chamber of primary teeth when compared to permanent teeth, how will it be? Will it be wider or will it be narrower, or it will be same width as permanent teeth, or none of the above? So always remember, when you compare primary teeth with permanent teeth, the pulp chambers are always wide in the primary teeth, and the pulp horns are present at a higher level. Whereas when you compare the permanent teeth, it will be slightly narrower than the primary teeth, and pulp horns are present at a lower level. So that is the main differentiating feature between deciduous teeth and permanent teeth when it comes to in case of the pulp. So the answer here is the pulp chamber of primary teeth is wider when compared to your permanent teeth. Fifth question, which of the following is not true? Again, please note it down, not true about diffuse calcification in the pulp. They are irregular calcific deposits. It is a type of dystrophic calcification. It follows the blood vessels or collagen bundles. It is common in coronal pulp. So all these first three are true. Which means what? Diffuse calcification is a type of dystrophic calcification. That is true. And it is usually seen along the blood vessels or collagen fibers. That is also true. It is appearing as irregular calcific deposits. Fine. But it is not seen in the coronal pulp. It is mainly seen in the radicular pulp or root canals. Therefore, this is the wrong option. That is, this is the false statement. So, this is the right option. So, the sixth question is, what is the average width of periodontal ligament? This is a very straightforward question, but I have put this because frequently in the NEET exam this has been repeated. The right option is 0.15 to 0.38. Please remember, 15 is just double of 30. So, the range will be 0.15 to 0.38. That is the width of the periodontal ligament normally. Which of the following are immature elastic fibers? So, the elastic fibers are of two types, mature ones and immature ones. Okay. So, mature fibers are called elastin. Immature fibers are called oxytalin. So, the answer here is oxytalin fibers. Collagen fibers are not at all elastic fibers. So, this option is wrong. Reticulin fibers are also different from elastic fibers. So, the right option is oxytalin fibers. They are the immature elastic fibers most commonly seen in the periodontal ligament. Eighth question. Which of the following is false about cementicles? So, cementicles are calcified bodies. So, that is true. They are degenerated epithelial cells. They form the nidus, which means from where is this calcification starting? Degenerated cell, because cementicle is also an example for dystrophic calcification. Any dystrophic calcification will start from a dead or degenerated tissue. So, this is also true. It is found in the periodontal ligament. That is also correct. It is found in cementum. No, that is false. So, the option here is, which is false about cementicles? It is found in cementum, because cementum is not where you see cementicles. Periodontal ligament is where you see the cementicles. Highest fluoride content is seen in which tissue? This is also very frequently repeated, straightforward question. The answer is cementum. The highest fluoride content will be seen in cementum. The radiographic appearance of bundle bone is called as, the right answer is lamina dura. It will be seen as a thin radio-opaque line on the radiograph, that is called lamina dura, which is nothing but bundle bone, or also known as alveolar bone proper. The other name for bundle bone is alveolar bone proper. So, what about lamina lucida and lamina densa? These two are parts of basal lamina, which is nothing but electron microscopic appearance of basement membrane. Whereas lamina propria is the connective tissue of the oral mucosa. Everything starts with lamina, so you should not get confused. Lamina dura is the radiographic appearance of bundle bone. So, the 11th question is, which of the following is true about basement membrane? So, it stains positively with periodic acid shift. It is 1 to 4 microns wide. It promotes differentiation, all of the above. Yes, all are correct. So, what you need to know about basement membrane is, it is a structure that is separating the surface epithelium from the underlying connective tissue. The stain, special stain that can be used for staining basement membrane is periodic acid shift. In short form, it is called PAS. The average thickness of a basement membrane under light microscopy is 1.4 microns or micrometers. The function of basement membrane is, it serves as an attachment between epithelium and connective tissue, and it also promotes differentiation of cells. So, all of the above is the right answer. The most active layer in protein synthesis is which layer of the epithelium? Basal, spinosum, granulosum or corneum? The right option is spinosum. So, this is again very repeatedly asked question. Spinous cell layer or stratum spinosum is the layer where active protein synthesis is happening, whereas stratum basal is where active proliferation or mitosis is seen. Which of the following is not true regarding Merkel cells? So, we know that Merkel cells are a type of non-keratinocytes. So, it is a non-keratinocyte in the epithelium. That is true. Okay. It is sensitive receptor cell. So, that is the function of Merkel cell. Touch receptor cell. That is also true. It stains positively with PAS, that is also true. That is a special stain for Merkel cell. It has dendritic process, is false. Only Langerhans cells and melanocytes have dendritic process. Merkel cells and lymphocytes do not have dendritic process. Cytokeratins are type of what? Microfilament, microtubule, intermediate filament, actin filament. The right answer is intermediate filament. It is called as intermediate filament because the diameter or size of this is in between microfilament, which is smaller in size, and microtubule, which is larger in size. This is larger, this is smaller. In between these two, you have intermediate filament, and cytokeratin is an example for an intermediate filament. It's an intermediate filament of epithelial cell. Which of the following has non-keratinized epithelium? So, in the oral cavity, gingiva and hard palate is having keratinized epithelium. So, these two options are gone. So, non-keratinized epithelium is called. So, please remember, it is a very, very important question that is frequently asked. Gingiva, the surface gingival epithelium is keratinized. There is no doubt about it, keratinized epithelium. But there are two areas of gingiva which appears non-keratinized. One is the caul area, second one is the junctional epithelium. So, junctional epithelium and caul are two areas of gingiva which is having non-keratinized epithelium, whereas the other areas completely free gingiva, attached gingiva, interdental papilla, any parts of the gingiva is keratinized. 16th question is taste buds are absent. Where do you don't see taste buds? So, you have four different papillae on the tongue. Filiform, fungiform, circumvallate and foliate papillae. Say if you take the tongue, this is anterior 2/3, this is posterior 1/3. It is separated by sulcus terminalis. So, this dorsum of the tongue has a lot of papilla. So, circumvallate papilla is seen below the sulcus terminalis. This is circumvallate papilla. Fungiform and filiform papilla are dispersed throughout the dorsum of the tongue. Filiform will be more towards the tip and lateral borders. Fungiform will be seen in the substance of the tongue. Foliate papilla are seen in the lateral aspect of the posterior part of the tongue. This is where the papilla will be present. Among all the papilla, only one papilla is not having taste buds, that is the filiform papilla. And that is the papilla which is keratinized, having a keratinized epithelium. Whereas foliate, fungiform and circumvallate papilla, they all have taste buds. Antrum of Highmore is covered by what type of epithelium? Now, this is a straightforward question, but the only problem is you have to know what is the other name for antrum of Highmore. Antrum of Highmore is nothing but the other name for maxillary sinus. So, the other name for maxillary sinus is antrum of Highmore, and that is lined by, now you know the answer, pseudostratified ciliated columnar epithelium. Oral cavity and skin is lined by stratified squamous epithelium. 18th question. This is also very, very frequently repeated in your NEET. That is why I mentioned here in this MCQ. Tuft cells are seen in which part? Whether it is seen in excretory duct of salivary gland, whether it is seen in maxillary sinus, temporomandibular joint or serous acini, the answer is excretory duct of salivary gland. Not in all the cases, but in some situations, in some individuals, in the excretory or terminal duct of the salivary gland, you have special type of cells. They are also the pressure receptor cells which may be seen in the excretory duct. They are called as tuft cells. Salivary IgA is produced by which cells? Serous cells, mucus cells, striated duct cells, plasma cells. Salivary IgA is seen in the saliva. So, immediately you will think that they will be produced by the serous cells or ductal cells. No. Irrespective of the location, immunoglobulins or antibodies are always produced by plasma cells. Please remember that anywhere in the human body, if you have immunoglobulins, any type of immunoglobulin it may be, the cells which are producing the immunoglobulins are nothing but your plasma cells. And where is the plasma cell originating from? Plasma cell is originating from B lymphocyte. So, the answer is plasma cell. The terminal duct of the sublingual gland is called as Bartholin duct, Vivinus duct, both A and B, Wharton's duct. Wharton's duct is wrong because that is the gland of submandibular. Duct is called as Wharton's duct. Whether it is Rivinus or Bartholin, both are correct. Both A and B are correct. Why? Because the sublingual gland will have multiple small ducts, which is called duct of Rivinus, which will all combine together and form one terminal duct, that is Bartholin. So both are the right answer. So the Stenson's duct is parotid gland's terminal duct. Supersaturation of calcium and phosphate ions in the saliva is due to which component? So the right answer is statirin. This is again very frequently repeated question for you. There are two components in saliva which helps in supersaturation of calcium and phosphate. One is statirin, the other one is PRP, proline rich protein. So what does this supersaturation of calcium and phosphate means? That is, whenever there is an acidic environment or pH of saliva is decreased, that may result in decalcification of the tooth. So you may get decrease in the calcium and phosphate ions that is removed from the enamel surface. So in that stage, you don't want caries process to happen, because in the next stage, organic matrix will get destroyed and caries and cavity will form. You don't want that to happen. So the body's protective mechanism, especially the saliva's protective mechanism, is that the components present in saliva, statirin and proline rich protein, these will take the calcium and phosphate from the saliva and they will form supersaturation and they will deposit this into the decalcified area of the tooth, and that is a protective function so that from decalcification, cavitation will not happen. So, but what is the function of the other three? All these are antimicrobial agents. So, saliva is also having antimicrobial property against bacteria, virus and fungi. So, histatin, cystatin and peroxidase are antimicrobial agents, whereas statirin and proline rich protein help in supersaturation of calcium and phosphate. Bicarbonate and phosphate ions act as buffers. Reabsorption of sodium and chloride takes place in which part? Already mentioned, salivary gland, you have different ductal system. Out of that, striated duct is very, very important because their active reabsorption of sodium and chlorine is happening. To compensate for that, so sodium and chlorine will be reabsorbed, and to compensate for that, potassium and bicarbonate will be secreted. This is happening in the striated duct. The type of cartilage that you see in temporomandibular joint, the answer is fibrocartilage. Why this I have put specifically here is generally in the joint area. If you take knee joint, elbow joint, anywhere in the whole body, joint area is usually hyaline cartilage. But exception is temporomandibular joint, because temporomandibular joint, though it is a synovial joint like other joints, it is not hyaline cartilage but it is fibrocartilage. The next question is plexus of Rashkow is seen in which part of the pulp? Already it is a straightforward question. It is seen in wheel zone. Wheel zone is otherwise called cell-free zone or also known as subodontoblastic layer, and this is the layer where you see the plexus of Rashkow, which is nothing but complete parietal nerves. All the nerves are forming a plexus here. The last question is which of the following is not true about myoepithelium? So it is not true. They are epithelial cells, that is true. Because they are having myoepithelial component, the epithelial cells, cytokeratin and muscle cells actin both are present. So that is also true here. They are associated with acinar cells and intercalated cells. That is also true. They are seen in association with terminal duct. It is false. So you will never see myoepithelial cells in association with the terminal duct. You mainly see them with acinar cells or intercalated duct. Rarely you can see with striated, but never in terminal duct. So this is the false statement. So this is the right option here. So with this, we have come to the end of the NEET based questions. So oral histology, a lot of questions are very straightforward as you were seeing in today's discussion. So very easy to pick the answer, but very few are twisted, and that time you have to carefully read the question as well as the option and then come to the right answer. So by repeatedly learning it and constantly keeping that in touch, so you put all these pharyngeal arches derivatives and all the other structures that you have to remember, the names, everything, you write it in a piece of paper and stick it in front of the wall where you're sleeping. So every day morning when you get up, every day night when you go to sleep, keep seeing this again and again. That's how constantly when you keep seeing it, it will be retained in your mind better. So that's how certain questions can be answered very easily. Thank you.